Do you answer yes to any of the following questions? When you eat, do you feel a sharp pain that lasts only a second? Do you avoid eating certain foods like apples, popcorn, or nuts? Do you tend to chew only on one side of your mouth? While you may be able to ignore the pain at first, you shouldn't. You may have a cracked tooth. There are several things that can lead to a cracked tooth. A cracked tooth may be due to chewing on hard objects or foods, like ice, popcorn kernels, or hard candy. An accident, like a blow to the mouth. Grinding and clenching your teeth. Uneven chewing pressure. Stress on a tooth. Loss of your tooth structure from natural wear and tear, large fillings, or other restorations. Exposure of tooth enamel to hot and cold temperature extremes, or brittleness of teeth with root canal therapy. Sometimes it can be difficult to tell if you have a cracked tooth. Although you might feel pain, it can be hard to pinpoint exactly which tooth hurts, or even whether the pain is coming from an upper or lower tooth. A crack in a tooth is typically invisible to the eye. Often a crack occurs as a hairline fracture, running vertically along the tooth. It may not even show up on an X-ray. You can help your dentist determine which tooth is causing you pain by paying close attention to your eating habits. If you experience pain from food, write down what you are eating and where you think the pain is located. Be sure to note if the pain is from hot or cold foods, sour or sticky foods, even from liquids. A cracked tooth may hurt because the pressure of biting causes the crack to open. When the bite is released, so is the pressure in the tooth. A sharp pain typically results when the crack quickly closes. Although the crack may be microscopic, when it opens, the pulp inside the tooth becomes exposed and irritated. Pulp is the soft tissue inside your tooth that contains all the tooth's nerves and blood vessels. When the opening and closing of the crack irritates the pulp, the tooth often becomes extra sensitive to extreme hot and cold temperatures. If the crack is left untreated and the pulp becomes damaged or diseased, endodontic or root canal treatment may be necessary to save the tooth. Treatment for a cracked tooth varies depending on the size and the location of the crack. Treatments range from bonding the tooth, which seals the crack, getting a crown to hold the crack together and strengthen the tooth, root canal therapy, which removes diseased or damaged pulp, or, in severe cases, a tooth cannot be saved and it must be pulled. Your dentist will determine the best treatment for you. To help avoid pain and potential dental work, be sure to schedule regular dental checkups with your dentist. Regular checkups are important since they allow your dentist to diagnose and treat potential problems in the early stage. Tiny cracks in a tooth are common and typically don't cause problems or pain. Remember, there are things you can do to help avoid a cracked tooth. Don't chew on the ends of pens or pencils, and never open a bottle with your teeth. When eating, avoid biting hard foods like popcorn kernels, hard candy, or ice. When cutting tape, be sure to use scissors and not your teeth. By incorporating a few simple precautions into your daily routine, you may help prevent a cracked tooth. If you have any pain while eating or drinking, avoid chewing on that side of your mouth and schedule an appointment with your dentist. Don't wait until it's too painful or too late. With the proper care and precautions, you can have a smile that's healthy and pain-free.